Hey everyone, welcome to another episode of What the Dementia by Bambu Care. I'm your host, Brianna Wilson. I am a certified dementia practitioner and the founder of Bambu Care. So last week we talked about palliative care and hospice, and we discussed why they're important, but we also talked about how they are different, okay? So if you haven't checked out that episode yet, then I would highly recommend it. It is really important stuff to know, okay? So I'll include the link in the description box, or you can just click an episode back, okay? In today's episode, we will be discussing the top 20 questions to ask when looking for a quality hospice provider. Now, I definitely don't expect you to remember all these questions nor write all these questions down. So what I've done is I've taken the time to create a handout of all 20 questions. So it has a section at the top for you to write down the name of the hospice provider as well as their contact information. So you can use it as a guide when you interview different hospice providers. So if you're interested in downloading that handout, you can go to www.letsbambu.com and click on the resources tab. The link is also in the description box below if that is easier, okay? Now, if you haven't watched our last episode, then I'll give you a quick rundown of what hospice is. And if you've already listened to the last episode, then we'll just consider this like a refresher, okay? So hospice care is a form of palliative care. Hospice care is comfort care, and it's provided for a person with a terminal illness when the doctor certifies that the person's life expectancy is estimated to be 6 months or less. So with hospice, you get additional layers of support, such as 24/7 phone access to the hospice nurses, the medical equipment and supplies that you need, hospice aid or volunteer support, respite care, bereavement support, things like that. And hospice care is typically covered by Medicare Part A, Medicaid, most private insurance, and it is also covered under the VA's standard medical benefits package. So you'll definitely want to talk to your partner's insurance company, okay, their health insurance company, and get further details so you know what all it entails. And then you're also going to want to ask the hospice what insurances that they take. And if you don't have any insurance, then you're going to want to know how much it would cost out of pocket if that's how you're going to pay for it, okay? So let's go ahead and get started with the questions because like I said, there are 20, so there's a lot to get through. If you don't want to hear me talk out all 20 questions, that's fine. Like I said, the handout is in the description box below for you to go download, okay? So question number 1. How long has your hospice been in operation? So this is a good question to ask because it gives you an idea of how stable the organization is and how experienced they may be in hospice care. It's definitely not like a mandatory type of question, but you definitely want to know if you'd be dealing with like a new kid on the block who's still trying to work out their protocols and processes, and they might not be hiring the best people because they're still trying to work things out, okay? You want to make sure that you're dealing with someone who has some skin in the game, as they say, and they know what they're doing, okay? Question number 2, what are your eligibility requirements? So we know that most hospices accept patients who have a terminal illness and whose life expectancy is 6 months or less, and they've been referred by their doctor. However, some hospices may have these additional eligibility requirements that your partner must meet, and so it's very important to know so you don't waste your time trying to get them enrolled and trying to get a doctor's order and your partner doesn't even qualify, okay? Question number 3, is your hospice accredited and if required, state licensed? So I personally recommend hospices that have been accredited by organizations such as Community Health Accreditation Program, the Joint Commission on Healthcare Organization, or the Accreditation Commission for Healthcare. The reason is that accreditation is completely voluntary. Hospices do not have to be accredited. So that means that any hospice provider who is accredited has gone above and beyond, and they're now expected to meet higher standards of care because now they've been through this accreditation process and now they have essentially eyes on them. Now, does that mean that all hospices that aren't accredited are bad? No, of course not. But going through the accreditation process adds like an additional layer of accountability for the hospice provider, okay? Question number 4, is your hospice Medicare certified? So if you're planning on using Medicare to cover hospice services, then this question is super important to know because the organization must be Medicare certified in order to offer hospice beneficiaries hospice services. However, even if your partner doesn't have Medicare for insurance, knowing the answer to this question could prove to be beneficial. This is because Medicare certified hospices must uphold a whole nother level of quality. Hospices must partake in Medicare guided surveys for quality control, and Medicare actually makes that data available to people, to the public, okay? So they have to meet certain quality requirements, okay? Question number 5, how does your hospice select and train employees? And does your staff have specialized training in dementia care? So for this question, they can literally tell you anything. But you want to make sure that their employees and volunteers have had background checks and they're not just letting anyone off the street come and provide services, okay? If their doctors and nurses have additional credentials like palliative care certifications or board certifications, then you know that they have been specifically trained in palliative care. You also want to know if they receive specialized training in dementia care, because we know that caring for someone with dementia, especially at the end of life, can come with some pretty unique challenges, and you want to make sure that the hospice team would be dementia informed, okay? Question number 6, what specific services can be expected or requested, and does the hospice offer extra services beyond those required? So you want to make sure that they at least have the basics covered, like the 24/7 on-call support, or the supplying of the equipment and supplies, or the respite care, bereavement support, things like that. But it's also good to know what other services they provide and if they have any like hidden treasures that they offer, but that you have to request for in order to receive them, okay? And then question number 7 is kind of related because now you would be asking, are there any services, medications, or equipment that the hospice does not provide? So of course we want to know what they offer, but what's also important is to understand what they don't offer so that you aren't surprised if you do decide to choose this hospice provider and then realize, oh, you guys don't do that, right? So it's also good to know what they don't offer. Question number 8 is, will the hospice provide training to family caregivers? So end-of-life care in general just comes with a lot of unique challenges and some scary moments if we're being completely honest. So if you're choosing to care for your loved one at home, it's important that you have training on both what to do and what not to do. And this can be at a very basic level, but you at least want to make sure that the hospice is providing you and your family, whoever's going to be caring for your loved one, with some type of training, okay? Question number 9 is, how often will a hospice team member visit, and how long will most visits last? Now, this will largely depend on the plan of care that they draw up after your loved one's admitted, but the hospice should be able to give you like a roundabout estimation of how visits with their team members typically work. And if they can't give you a for sure answer at this point, then whatever hospice provider that you decide to go with, you want to make sure that you understand how long and how often these visits are supposed to be taking place, because you want to hold those team members accountable. Now, I don't work in hospice, I work in home health outside of Bambu Care, and I know, because I see it all the time, that people sometimes don't stay for the amount of time that they're supposed to, okay? So if the company tells you that they're supposed to be staying for an hour or 45 minutes to an hour, then you need to make sure that they're actually staying there for the time that they're supposed to and not just coming for 10-15 minutes and then leaving, okay? So just keep that in mind. Question number 10 is, how rapid is crisis response? So if the family needs someone to come to the home at 2 a.m. on a Saturday, what is their average response time? And this to me is probably one of the most important questions and why a lot of people get in a pickle, because some hospices unfortunately are not responsive. You try calling the 24/7 number, people are not answering, or they're giving you the runaround, or people just aren't helpful. And so your loved one ends up suffering because you can't get that rapid response, that responsiveness that you need. Okay? So this is an important question to ask. Now, again, they can tell you anything in response to this question, which is why you always, always, always want to check out reviews of the hospice. And if you can, talk to someone who is either currently or who has previously used the hospice provider, because you really want to know how responsive they are and that they will be available within a timely response and get there when you need them most, okay? So question number 10 is so important. Question number 11 is, if the family caregiver needs a break, can we get respite care? How does it work? So the hospice may briefly touch on this when they outline like their services, but you definitely want to get further details on how respite care works and how you can request for it, how long it lasts, and then how often you can request it. You just want to know how their respite care works. Question number 12 is, what happens if we can no longer manage our loved one at home? So unfortunately, even though end-of-life care for someone with dementia can just be challenging all on its own, people with dementia often have other comorbidities such as diabetes, vascular heart disease, hypertension, chronic obstructive pulmonary disease or COPD, musculoskeletal disorders, and chronic cardiac failure. Therefore, there may be some additional challenges in caring for your loved one that just may become too much to handle at home. Also, we have to take into consideration that life happens and situations change, so it's just important to know what the hospice provider can do for your loved one if they can no longer be managed at home. Question number 13 is, how are patient and family concerns handled? So you may have questions, concerns, or complaints, and no matter what they may be, they matter. And so you want to know that the hospice is responsive and that there is a sensible way of speaking to someone, verbalizing what you need, and for them to have at least some level of action that they take, because you don't want what you say to just fall on deaf ears, okay? There needs to be at least some process of handling patient and family concerns. Question number 14, does the hospice prepare families for the death of a patient if there is not a member of the hospice team present at the time of passing? So this is especially important because when death happens, it can be scary, especially if you're not expecting it or if you don't know what to do. So there are definitely some signs of active dying, such as the limbs falling cold, or, the skin is becoming mottled, which is like this bluish purpley marbling of the skin, or drastic blood pressure drops, or urinary incontinence, or their urine may become like dark and discolored. There may be like long pauses in breathing and a gurgling sound, which we also call the death rattle. But no one knows when the exact moment of crossing over will be. And so it's important that you know what to do, who to inform, and then what. And your family may also have some type of special ritual that you want to perform. So some people choose to clean up the body, fix the hair, get them dressed. If it's a woman, they may want to paint the nails. Some people may have a special prayer that they want to read, or some other type of ceremony or ritual that they want to do. But it's important that you know what the hospice expects the protocol to be and what order all this should occur. Should you call the hospice first, or the funeral director first, or this or that? So you just want to make sure that you're clear on how that works and that they're going to prepare you for that. Question number 15. What kind of bereavement services does your hospice offer? So hospices are required to offer 12-month bereavement support after the passing of your loved one, but this could look different. So it could be one-on-one, it could be in groups, it could be over the phone. So you just want to know. And you also want to know, well, is this bereavement support just for the primary caregivers, or is it for the immediate family too? Can it involve others who are just close to your loved one, but they're not necessarily family? So it's just a really good question to get some additional information on, okay? And then we have question number 16. If we wanted to continue with this hospice, what would be our next steps? So it's important to know who's going to do what and how that process would go, because what you may find is that some hospices are more involved and they'll kind of help you throughout this process and be more hand-holding, and others, they put a lot of the responsibility on you. So you just want to be sure, like, if we're continuing from this point, what's next and who's going to do what, okay? Then questions 17 through 20 are just reflection questions, because you want to note if you have like a follow-up meeting or call with the hospice. You want to note what your initial impressions were and if there were any like red flags or any bad vibes that you might have gotten from the person you were talking to. You also want to consider if you honestly feel like that particular hospice would be able to provide the best care possible for your loved one. Okay, and follow your gut. If there's something in your gut saying, I don't know, some of the things they said sounds good, but something just doesn't seem right, it probably isn't, okay? Keep looking, okay? Please keep looking. And then you also want to consider if it meets your expectations to be one of your top 3 choices, because eventually you have to narrow them down, okay? So I hope this was informative and valuable. Again, don't forget to download the handout if you are interested. The link is in the description box. If you aren't sure if hospice is right for your partner at this time, please call a hospice provider, contact the doctor, and just ask questions. It's never ever a bad time to ask questions. And also, don't forget that there's palliative care. And palliative care is comfort care that can be provided at any stage along this disease, along this condition, okay? So if you have any questions or comments for us or any future podcast requests, you can send us a voice message on whatthedementia.com or send us an email at podcast@whatthedementia.com. Thank you so much for joining us on another episode of What the Dementia by Bambu Care. We look forward to catching you on the next episode. Take care, and until next time, stay strong, carry on, and remember, you are not alone. Bambu Care is always here.